Welcome back to Andersen Acres. We are out here with Libra today, and today we are going to be diving into a really important topic for all rabbit owners. Whether you raise rabbits as pets, for show, or even for meat, this issue can crop up. I'm talking about malocclusion in domestic rabbits. This is a condition where a rabbit's teeth don't align properly, leading to overgrowth and serious health problems. Malocclusion can cause pain, difficulty eating, and even life-threatening complications if you don't treat it promptly and effectively. But don't worry, I'm going to cover everything you need to know, from spotting the signs to managing and even preventing it when it's possible to do so. So let's get to it. Malocclusion is a misalignment of the teeth, and in rabbits, this can be a bigger problem because their teeth never stop growing. In fact, a rabbit's teeth can grow up to 5 millimeters per week. That is crazy fast. 5 millimeters per week equates to approximately a centimeter every 2 weeks, or 2 centimeters a month. That can be almost an inch a month. Almost an inch. That's crazy. That is a crazy, crazy amount. If the upper and the lower teeth don't align properly, they won't wear down the way they should. This leads to overgrown teeth that can curve into the mouth, pierce the gums, and even prevent your rabbit from being able to eat at all. Malocclusion is often genetic, but it can also be caused by injury, poor diet, or even some environmental factors. So, how can you tell if your rabbit has malocclusion or might develop it? Okay, let's talk about it. So some of the common signs of malocclusion in rabbits is overgrown teeth. So you might notice teeth that are visibly too long or curving in unusual directions. They just don't seem like normal rabbit teeth. You might notice excessive drooling. So if your rabbit's chin is constantly wet, it could mean that they're struggling to close their mouth properly. So always check under the chin and see if there's any wet spots, because a wet chin, especially if they weren't just drinking out of a bowl of water, that's not a good sign of anything. It could be malocclusion, but it could be something else. So always keep an eye on that chin. If they have difficulty eating or a loss of appetite, if they're avoiding their hay, struggling with hard foods, it really could be that their teeth are the issue. If there is unexplained weight loss, so if eating becomes really painful, rabbits with malocclusion can start losing weight because they're not eating enough, even if they are eating some. You also might notice facial swelling or abscesses. Overgrown teeth can push into the gums and create infections. If you notice any of the signs that I just talked about, it's time to take action. The earlier you catch it, the better the prognosis is for rabbits with malocclusion. So what causes malocclusion? It can be genetic, like I mentioned, meaning some rabbits are just born with misaligned jaws. This is especially common in some dwarf breeds and rabbits with shorter shaped skulls, like Netherland dwarves and lionheads. It can even be a thing that happens with your Holland lops. So before I breed a rabbit, I check their jaw thoroughly. I check their teeth, make sure they're lining up. You cannot have malocclusion in a rabbit you're breeding. That is a sure sign of terrible things. So you want to check the teeth, check the jaw, make sure everything's lining up as it should. Do not breed rabbits that have malocclusion. Okay? There are so many beautiful, healthy rabbits out there that we do not need to breed genetic malocclusion. So don't do it. So it can also be environmental though. It's not all genetic. Some rabbits develop malocclusion due to injuries. Maybe they fell or they chewed on something that damaged their teeth. Something like that. So if that's the case, then it's not genetic. I err on the side of it's always genetic, but if it's environmental, you could potentially breed that rabbit. I wouldn't, because you think it's environmental, but what if it turns out it's genetics? I wouldn't do it anyway. Another major factor could be diet. So rabbits need a high fiber diet to naturally grind their teeth down. If they aren't eating enough hay or they aren't getting enough food in general, their teeth will not wear down correctly. This is why a proper diet is essential for preventing dental issues. If you're worried about malocclusion, also include a bunch of things they can chew on, like some applewood sticks. I like applewood sticks and bamboo sticks. something that'll help them basically sand down their own teeth. That's what they need to be doing. So, what happens if your rabbit has malocclusion? Well, if your rabbit does have malocclusion, you don't need to panic. There are several things you can do to manage it. So, you could go for a regular trim. Some rabbits do need routine tooth trims. A vet can do this that is a specialist in rabbit care. They have specialized tools, and in some cases, your vet might be comfortable teaching you how to do it, and you might be comfortable learning how to do it yourself. But I don't really recommend trying this because unless you're trained, improper trimming can really lead to like fractures and infections, and I don't recommend people trim the teeth of their own rabbits. Take them to a vet, okay, if this is an ongoing issue. You might consider having the teeth that are causing the problem extracted. In really severe cases, vets may remove the problem teeth altogether. Rabbits can still live happy, healthy lives without certain teeth. This will require specialized care afterward, and you may end up having to do things like soak pellets in water so that they can eat them anyway and stuff like that. Okay, so it's possible to remove the teeth. You will completely have to change their diet. You can also try adjusting the diet of your rabbit to help wear down those teeth. So if your rabbit's malocclusion is mild and you're pretty sure it's not genetic, try increasing their hay intake and providing chew toys, because this can slow down the problem. Timothy hay is the best option for this particular problem because it's coarser and it's more likely to basically wear their teeth down because it's almost like sandpaper. If you run Timothy hay between your hands, you will notice that it's way rougher than like an oat hay or something like that. So you definitely want to use Timothy hay if your rabbit will eat it. But what about preventing malocclusion? So your rabbit doesn't have it yet, but you're worried about it. So let's talk about that. Even if your rabbit doesn't have malocclusion and you're not even worried about it, probably taking the steps to prevent it will just avoid long-term problems. So you might think about feeding unlimited hay. Hay should make up 80% of your rabbit's diet anyway, and I never restrict hay. Okay, I don't restrict hay at any stage or age of rabbit. If they want to eat hay, they get to eat hay. This helps to wear their teeth down naturally. I've not had to deal with a rabbit with malocclusion since I was quite a bit younger, and rabbit care hadn't really advanced to where it is now, and we didn't know you're supposed to feed hay. This was a long time ago. I'm portraying my age. But we didn't know that rabbits were supposed to have hay. We figured that pellets were good enough, and it's not really good enough to wear down those teeth. So once we started providing hay, I never had malocclusion happen ever again. Now that was a long time ago. I have learned since then. You have to remember this was the 90s. Again, betraying my age. Rabbit care wasn't really a thing yet. Okay? They were barely pets. You can also try providing chew toys. Wooden toys, apple branches, and even untreated cardboard can encourage natural chewing. We do that a lot. We provide a lot of things for them to chew on. Also consider regular checkups. Even if your rabbit looks fine, checking their teeth monthly can help catch issues early. I do a thorough exam on each rabbit I have every single month. I check their teeth, I check their jaw, I just make sure everything's lining up the way it's supposed to. That way, if it's not, I can catch the issue early. You also might want to consider when you're breeding your rabbits, avoid breeding ones with a history of malocclusion. Like I said, it can be inherited. If you do that, then you'll slowly eliminate malocclusion from your lines. So any rabbit that has any symptoms of malocclusion, just don't do it. Taking all of those steps above can help prevent a lot of pain and stress for both you and your rabbits. It's good for you, it's good for them. So do what you can to prevent malocclusion from happening in the first place. So that's basically everything you need to know about malocclusion in rabbits. It's a serious condition, but with early detection and proper care, it can be managed. So that's about it for us here today at Andersen Acres. If you have any experience dealing with malocclusion in your own rabbits, don't forget to drop a comment below. I'd love to hear from you. And so would everyone else. The more we share, the more we know. We'll see you tomorrow.